Hi, my name's Dr. Adams, and I'm a dentist with Holistic Serene Orthodontics. I have gotten a lot of questions about how to, use mouth tape and whether mouth taping is a good idea and when should I do mouth taping. Um, Mouth taping is an invaluable tool that should be used to break the habit of mouth breathing, and if all someone really has is a mouth breathing habit, the mouth tape will work. But I would say 9 times out of 10, most people have some real airway issues, where we need to take a look at the root cause of why they're mouth breathing. And those causes always come down to there not being enough space. And there can be some other complexities. Over the year, people may develop like blockages in their nasal passageways and like sinuses. They may need the help of someone like myself to get their jaws to be the right size and shape, and a knowledgeable ear, nose, throat doctor to, get in here and, clean those nasal passageways out. With the book that most recently came out not too long ago by James Nestor about breath, I've been getting a lot of patients interested in improving their health through breathing better and sleeping better. And everyone who's read that book knows that one of the most central subjects and goals is to breathe better by first and foremost breathing through your nose instead of your mouth. There's a lot of benefits to breathing through your nose, and if you're an habitual mouth breather, taping your mouth to literally force yourself to breathe through your nose can be a considerable strategy. And there's a lot of considerations for doing that. So let's talk a little bit about that. First off, from an airway standpoint, we know that our airway is going to get as small as it's going to possibly get at nighttime. When you go from light sleep into deep sleep, all the muscle tissue that lines your throat, and your muscle is a very large moving part. Your tongue is a very large muscle that's a moving part in your mouth. And sometimes when people get into deep sleep, all the muscle tissue that lines their throat and their tongue will have a tendency to relax, and the airway is going to get as small as it's going to possibly get. And that's why we see the most severe airway and breathing problems occurring at night, and certainly as the tongue falls back into the throat and the airway gets smaller, that'll create some of the airway collapse that can cause sleep apnea. So one of the issues with breathing through the nose is when you close your mouth and you breathe in through your nose, your airway actually starts with your nose, so the air that flows literally through your nasal passageways and down your throat is in the central part of the airway, and that is going to act to inflate your airway, literally blow it up. You can think of the airway kind of like a floppy hose. So, if you start blowing air or passing fluid through a floppy hose, it's quite literally going to blow, inflate the hose. Or so much is the same thing when you breathe into your nose. That airflow is proper, and from an airway dynamic standpoint, the air that flows through your nose is going to inflate your airway. Now we contrast that with the airflow that comes in through your mouth. If you don't breathe in through your nose and you breathe in through your mouth, or oftentimes ends up happening is you get some of the air coming through your nose and some of the air coming through your mouth. It's kind of like you have air coming through your nose and air coming through your mouth, and you have kind of like a hose up top and a hose where you're like an airway entry into your mouth. And think of like two hoses that kind of come together, and there's going to be a pressure differential where the two meet, literally like right here, and you're going to get this like flapping around of like airway and air pressure differentials. And believe it or not, that's going to actually act to kind of collapse and suck the airway down. I know that might be a little bit confusing. Also, when you draw in air through your mouth, there's a lot of flappy tissue like tonsils and adenoids, and the tongue can sometimes be kind of flabby and saggy, and you can quite literally, the air that's going to come through your mouth is going to sometimes suck that tissue back into your throat. And what I'll normally tell people is, look, the airflow that goes through your nose, simply put, it's going to inflate your airway, and the airflow that goes through your mouth is going to act to collapse your airway and suck it down. Think of that floppy hose thing, where if you get air pressure that's too great, where you get kind of like this vacuumy, suctiony airflow, it's going to literally suck the airway down and collapse it. There's a lot of other reasons why people might want to breathe through their nose instead of their mouth, but let's not lose our focus and start talking about this mouth taping thing and how you can tape your mouth and sort of try to break the habit of mouth breathing to improve your health. The first thing you want to do is, let me back up. I do believe that there are some people that, as a matter of habit, will breathe through their mouth. And if there's some treatments that have been done to sort of improve the structure of the airway, could be surgery, could be dental appliances. Sometimes once you get the structure and you get the muscle tone and everything right, you think you're perfect and you're ready to go, and you're going to magically create this nose breather, and the person still, just out of habit, breathes through their mouth. So here's what you do. First thing you want to do is you want to verify that you can actually get the air that you need through your nose. So what I always tell my patients is, let's start mouth taping during the day. And what you can do is, while you're watching TV, you're reading a book, you're doing non-exertive activity. You certainly don't want to start this while you're exercising on a treadmill or stationary bike or some kind of aerobic or anaerobic activity. What you want to do is be relaxing, watching TV, reading a book, and something along those lines. So what you'll do is you'll get out your tape. They actually have special tape for mouth taping, and this is not special tape, but what you can first do is just a little bit of encouragement. You don't need to jump right to literally duct taping your whole mouth closed. If you just take a little piece of tape and you put it here, you can do that. And if I get to the point where I just am not getting enough air, naturally my face is going to turn purple, and I'm going to rip this off, and I'm gonna open my mouth and start breathing again. So if you can actually tape your mouth and you can maintain some non-exertive activity, start with 20 minutes, maybe get up to an hour, 2 hours. And if you can endure that during the day, then I think the next step is to go ahead and try that at night. Start trying to tape your mouth at night. And certainly if this little mouth encouragement is not enough to, do the job, you can get out a much bigger piece of tape and tape your entire mouth. And I've seen people that get pretty, they do things while they're sleeping. So, the more the tendency is for you to want to try to, take that off during the nighttime, you can use some stronger tape. Most of the time, people that are breathing through their mouth, and some people aren't pure mouth breathers. They'll breathe sometimes through their mouth, sometimes through their nose, and the more they are a pure mouth breather, the more likely it is that mouth taping is not going to be the only thing that you need to do in order to get your breathing to occur properly through your nose. And there's a lot of reasons why people, the tape won't be the only thing that you need to do. The first thing comes down to the actual size and shape of the structure. You think about what's going on here. You have your mouth, you have your nose, and if you're going to breathe through your nose and not your mouth, the obvious first thing that has to happen is you have to be able to actually get enough air through your nose to meet your oxygen demands. So if you can't get enough air through your nose, well, guess what you're going to do? You're going to actually open your mouth because it's a bigger hole, and you can funnel more air through your mouth to get into your lungs. The second thing that can be a real issue with I guess airway performance in general is strength of muscle tissue that lines your upper airway. And sometimes people will get confused with the language of airway. You'll hear references to upper airway. And generally speaking, the upper airway is everything that leads up to this pipe right here, where your throat starts. So we're talking about your mouth, we're talking about your nasal passageways, the space where your tongue's confined, your tonsils, your adenoids, all that tissue. So, a few minutes ago I was making a reference to you can think of the airway, this is the airway, the mouth and the nose are the upper airway. So now we're talking about the airway. You can think of the airway like a floppy hose, and where the backbone of the hose is literally the muscle tissue that lines the airway. And over time, as people get older especially, that tissue that lines the airway can get weak, it can get a little flabby, it can get a little saggy, and it's much easier to collapse that airway. I mean, sometimes literally all people have to do is suck in too fast and hard. If you have a hose and you suck in too hard, haven't you ever sucked it so hard and fast that it actually sucked it closed, and then once it collapses, you're not getting any air through it at all. So one of the and of course that's the tissue that lines the throat. The other big muscle in the mouth, and it's actually in the upper airway, is the tongue. So especially when the mouth is small and the tongue is really big, the tongue function is going to be poor. The tongue muscle tissue is going to be weak, and that tongue is going to be really flabby and saggy, and it's really going to have a tendency to, especially when you go from light sleep into deep sleep, it's going to relax and fall right back where it fits better, which is back into the throat or the upper airway. And then when you're trying to pull air, through your nose, hopefully, and if not through your mouth, you're going to suck that flabby, saggy, weak tongue back into the airway that's already not really a very good, strong, hose or airways. So I think you're beginning to get the idea. So one of the things that you might need to do before taping your mouth and trying to draw air through your nose, thinking that that's going to be the only thing that's going to solve your problem, is you actually need to work on strengthening the muscle tissue in your airway and in your mouth. So there's certain breathing exercises you can do. I have a number of other videos that go over, different issues related to airway, but they have these gadgets that look like balloons. Have you ever tried to blow up a balloon? You're really huffing and puffing, and you feel like you're really, getting a pretty hard throat workout. Those kinds of things will really strengthen that muscle tissue that lines the airway. The other thing you can do is you can do tongue exercises. There's a doctor, his name's Dr. John Mew. He has quite a few different tongue exercises, and this whole, they call it mewing, MEWING, which is a series of exercises to get the tongue to start functioning better and get stronger. And there's actually a whole group of specialists called myofunctional therapists, and they're kind of like speech language pathologists, and they're literally physical therapists for tongues, and they'll tell you like, do this, do that, stick your tongue this way, stick your tongue that way, do this and that with your tongue, and it'll strengthen and improve the function of your tongue, and your tongue won't be so flabby and saggy. What the tongue is really actually supposed to do while you're sleeping and while you're at rest during the day is, if you were to do a tongue check and I weren't talking and doing anything, if I were to just sort of ask myself, well, where's my tongue? I should actually find my tongue resting on the roof of my mouth. And that's where my tongue should rest. And the tongue should sit up on the roof of your mouth, kind of like a suction cup. And when it's suctioned up there, it's not going to be like falling down into the lower part of my mouth and flopping back into my throat. So a lot of tongue exercises out there that myofunctional therapists will give you will be targeted at strengthening your tongue and improving its range of motion so that it stays in the roof of your mouth. Because if your tongue's in the roof of your mouth and it's sitting up in there like a suction cup sits on like a pane of glass, it's not going to be falling down and hanging out in your throat. So you can begin to see how one of the crucial things that's going to happen in order for you to start breathing through your nose and not through your mouth is you're going to need to strengthen the muscle tissue in your airway to keep your airway open and prevent it from collapsing. And the other thing you're going to need to do is you're going to need to keep your tongue out of your throat by performing exercises to strengthen your tongue and keep your tongue in your palate where it belongs, so it's not falling back in your throat and blocking your upper airway. We were talking about, and actually, since we're talking about tape, you can begin to see how ridiculous it would be to think that if you have these tongue issues and this flabby, weak airway tissue, and if you can't even get enough air to flow through your nose to meet your oxygen demands, that you're sure as heck not just going to get a piece of mouth tape and stick it on your mouth and think that somehow or another that's going to like solve all your problems. I think that the mouth tape is really more or less a tool, a retraining tool, that once you get the muscle tissue, the tongue and the throat to be strong, once you get the size and shape of your mouth large enough structurally, and we're going to talk about that, because if you don't have enough room due to a blockage, or your nose is quite literally too small to, if you can't get enough air to go through your nose to, get enough oxygen into your lungs so that you don't suffocate, how are you going to tape your mouth and, become a nose breather? It's just really not going to happen. Just to give you a little bit of reference, where I am, where I'm coming from this in this area. I have a lot of I'm a dentist, and I do a lot of these dental appliances called expanders, and I hate the word expansion because it makes it sound like we're like mechanically moving people's jaws, which is not all that we do. That's not what the appliances do at all. They stimulate growth. That is, they stimulate the jaws to grow to be, a larger size and shape. And it just so happens that the upper jaw, the maxilla, and specifically like the palate, like right here, that is the same bone as the base of your nose. So a lot of times when kids are growing, they don't grow to be big enough for all their teeth to fit, and they'll have crowded, crooked teeth, and they'll go to the orthodontist, and the orthodontist will put some kind of expander in there, and the whole goal is to get their teeth straight, which the expanders can definitely straighten the teeth, but for purposes of like breathing through the nose, there are special expanders that will change the size and shape of the palate so you can literally get enough airflow. You'll start getting more airflow through your nose. So, I mean, it only makes sense if your nose is like too small, structurally, it needs to be bigger. So these appliances can be used to, so people can, believe it or not, actually get more airflow through their mouth. And they have expanders that work for adults and kids. And there's a variety of different reasons why people sometimes come to see me. Sometimes they just want their teeth straight. There's not enough room. Sometimes they're clenching their teeth at nighttime because they're not breathing properly. The nighttime airway problems typically will cause people to clench their teeth to varying extents. So, I get a lot of people that come into my office to talk about these expanders, and sometimes they'll have sleep apnea even, and they will want to get rid of their sleep apnea. They'll want to get rid of their TMJ and jaw pain. And it's these same people that aren't breathing properly at nighttime. The nighttime airway collapse is really the root cause of why people clench their teeth at nighttime. And a lot of these people that have TMJ pain will clench their teeth also during the daytime. And since there's not enough room in the mouth for the teeth to fit real well, no surprise when people kind of bite down, the teeth don't really fit together in a great way, and it's not very functional or comfortable. So people can sometimes grit their teeth during the day, and these issues of the teeth not fitting great and the bite not being great will, create a lot of tension in the neck, and it'll affect the way the head sits on the shoulders, and people will start having postural problems. But anyway, I've got a lot of videos that go over how to use dental appliances to treat TMJ and improve airway resistance. And if you want to watch some of those videos, but anyway, my name is Dr. Adams, and hopefully I clarified some of the issues of mouth taping and how it impacts people's ability to retrain themselves to start breathing through their nose. Anyway, have a nice day.